Cancer. It's a word that can silence a room.
Whenever you heard a word called cancer, everyone in India feels that they are seeing the last day of their life. I've been practicing and I've performed more than 40,000 surgeries.
Today's guest lives within this reality every single day. Very few people actually even know that there is a specialization of head and neck cancer.
All closed structures like different nerves that are supplying your vocal cord, the different vessels that are entering in and out from the brain to the different parts of the body are situated in this small area. These are the malignancies that can be encountered and tackled by a surgeon who is specialized in performing this sort of surgeries.
Majority of your patients are men or women?
70% are men. Addiction is the most common cause.
Like bidi, gutka, cigarettes. How much of cancer is just fate? How much is lifestyle?
Coming to lifestyle, what a lot of individuals have a wrong thought process nowadays I've seen. Sir, we don't smoke, but we do vape. 213 different carcinogens have been identified which are being used in different combinations to create different flavors.
Do you think the science is willing enough to cure the disease, or they just want to treat the disease? As you've heard in the introduction, today's guest is Dr. Amit Chakraborty. The topic today is very serious and the discussion is going to be really enlightening. Welcome, Amit.
Thank you.
You don't look very old, so I may sometimes just call you Amit rather than Doctor. You're also a Bengali, so there is a connection.
100%.
And I must appreciate the work that you've done. Overall, as far as we have been able to research about you, it has really encouraged us in a way that we did not expect. But I would rather talk about all of that in a separate podcast and explore and, peel those things later. Today, we are going to talk about cancer. First of all, for everybody who's listening to this, I want you to explain what cancer exactly is.
So basically in everyone's life, there is a normal cell cycle and every cycle has got its own phase, right from its growth till the death of that cell. What it happens when this cell cycle gets affected by any of the stimulus, whether it is an environmental stimulus, whether it is a genetic stimulus, whether it's stimulus coming from your dietary habit or any addiction. So mutations occurring at any part of this cell cycle results in abnormal growth of cells. When this abnormal growth of cells keeps on repeating, then the cancer evolves.
So if somebody is not diagnosed with cancer, there's a lot of social media talk and buzz going on that actually everybody produces cancer cells, but their bodies are able to kill those cells with their immunity. Is that true?
No, it's not true. Basically, see what it happens. Again, I've told you pertaining to cell cycle. Cell cycle is why important? Because it's a repair mechanism. Suppose you're getting one dietary stimulus or addiction or environmental exposure. So your cell has that capability to mutate that particular mutation. But if that stimulus is coming to you repeatedly, then it is beyond the capability of that cell cycle to repair, and that's where cancer starts developing.
Does a normal person's body also generate cancer cells?
No.
So this is a myth that everybody's body creates cancer cells.
Yeah.
Wow. Why do you think we still feel uncomfortable talking about cancer?
See, what is the most important myth surrounding this is that whenever you heard a word called cancer, everyone in India feels that they are cancelled, as if they are seeing the last day of their life.
Right.
Which is not. So, whenever you want yourself that you have got diagnosed with cancer or suspicious symptoms, I would encourage each and every individual to get themselves screened, checked by a certified oncologist who is specifically trained in treating those conditions. And whatever advice they give it to you, just follow it.
What is your educational qualification in terms of cancer and oncology?
So I've done my MS General Surgery from Sion Hospital, Mumbai. And after that, I've done my MCH Surgical Oncology, that is Masters or Super Specialization in Surgical Oncology, from Gujarat Cancer Research Institute. It's a regional cancer center in Ahmedabad. After that, I've been practicing and I've performed, say, more than 40,000 surgeries.
40,000 surgeries.
Yeah.
Wow. And do you have any way of tracking whether those people, what kind of lives they're living, have they survived, what is their quality of life?
It's a great question. See, what is most important? What sort of cancer we are treating is the most important in Indian scenario. And unfortunately, because of lack of education or fear, most of the patients we see mostly landed up, say, around 50 to 60% in stage 3 and stage 4.
Correct.
Right. We definitely have got a central registry maintained. So what we have seen, around 30 to 40% of patients, they are after 5 years of, say, anti-treatment, they are lost to follow due to different reasons. Either they feel they are out
Cured.
of danger and they are not in your touch or in your routine surveillance. 40% very strictly they are following up with you. And 20% we have lost them in their entire throughout the journey.
So out of 40,000 people,
Yeah.
oddly that you've done a surgery on, how many do you think have survived the first 10 years after the surgery?
Almost 20,000.
So 50% of them have survived for more than 10 years.
Yes.
That is great. You spoke about super speciality or specialization into one particular section or one particular organ. What is your specialization?
So, see, MCH Surgical Oncology is a comprehensive degree where you are trained in performing surgeries for each and every part of the body.
Okay.
Right from head and neck cancer, breast cancer, thoracic cancer, GI cancer, gynecological, and bone and soft tissue.
Okay.
But now the entire era is moving towards organ-specific surgery. And currently, in our team, I am focused in performing head and neck cancer surgery. And if you see the overall Indian incidence of the cancer, so out of 100%, at least 33 to 40% comes from head and neck cancer due to different reasons.
Okay. Before we get into the percentages, I want to first understand what do you actually mean by head and neck cancer? Because mostly the cancers that are talked about are breast cancer or an ovarian cancer that mostly happens in women, bone cancer or blood cancer. There is also a degree of talk around lung cancer, but very few people actually even know that there is a specialization of head and neck cancer. Can you just explain on that?
So head and neck cancer is a cancer which is arising, say, from any part of your oral cavity, from your lips, your gums, your mandible, tongue, posterior part of tongue, this laryngeal area, oropharynx, thyroid cancer, or cancers from your parotid. So these are all the regions from your head and neck region which encompasses that these are the malignancies that can be encountered and tackled by a surgeon who is specialized in performing this sort of surgeries.
It must be very complicated.
It's a complicated, yeah, because all closed structures like different nerves that are supplying your vocal cord, the different vessels that are entering in and out from the brain to the different parts of the body are situated in this small area.
Yes, because if you consider a cancer in the breast, it's an organ which is practically outside the body.
Yeah.
Is
The
what
most
the doctors say.
safest organ.
The safest organ to be operated on.
Yes.
When you talk about a neck cancer or a mouth cancer, it directly affects the quality of life. It directly affects how the person is going to live. What sort of challenge or risk do you think is involved when you see a person like that?
See, basically what is most important whenever we are performing surgery or advising surgery to any patient of head and neck cancer, we assess the patient as a whole in terms of their overall comorbidity status and the current disease status. So what is most important, the earlier the patient gets diagnosed, the lesser is the comorbidity, shorter is the operation time. The more delayed the patient presents, the more long duration is the surgery and more chances of comorbidity being there with the patient for a long time. So the main important challenge is that if you reach early, my surgical duration will be very small, say 2 to 3 hours. If you reach late, so then I have to perform surgery which has got two parts. One is the removal of your entire tumor that we perform. Suppose I remove your jawbone and along with that do a neck nodal dissection. And if jawbone is removed, then I have to do a plastic reconstruction. That will again add 4 or 5 hours. So entire surgery duration will be 8 to 10 hours.
Wow.
And the patient has to stay in the hospital for 7 to 8 days minimum.
So that is when a neck or a mouth area is considered. I mean, pardon my
Yeah.
restriction of language because I'm not very thorough with the jargons that you use medically.
Yeah.
When you say head cancer, what do you exactly mean? Does it involve the brain? Does it involve anything else? Please explain.
So brain cancer is basically dealt by a neurosurgeon.
Okay.
And head is anything which is coming from base of the skull till oral cavity.
Okay.
So we treat all the tumors arising from paranasal sinuses, from mandible, jawbone, reaching up to the base of the skull, and anything which is above the collarbone, that is your clavicle.
Okay.
So this is an area where head and neck cancer surgeon is specifically focused in performing the surgeries.
Majority of your patients are men or women?
70% are men.
70% are men. Why do you think that is?
The most common reason is, again, around 60 to 70% have addiction as the most common cause.
Addiction.
Yeah.
Such as
Tobacco consumption in different forms.
tobacco consumption in different forms like BD, gutka, cigarettes.
Yeah.
What is the unfamiliar cause that you figured out as a cause?
See, recently we have been diagnosing almost 20% of cases occurring due to HPV, human papilloma virus. You all might have heard that coronavirus, COVID struck, everyone got themselves vaccinated.
Yes.
Now this HPV is one of the nuisance here, but the advantage is that it is a vaccine preventable cancer.
Oh, so there are vaccines for HPV cancer.
Yes. So these are basically, now we have got approval for a nanovalent vaccine, a vaccine which covers 9 strains, and it can prevent cancer in both males and females. Previously, this vaccination was only for females, that too from the age group of 9 to 23 years. And you should ideally get vaccinated before your first sexual exposure.
Is it available in India?
Very much available.
Okay. Doctor, as you rightly said in the beginning of our conversation, when people talk about cancer, they think it is the talk of the end. People don't want to talk about. I myself have personally experienced because of my family. I want to understand one thing. When we say cancer, as a person with medical background, as a person who's a doctor, as a person who does surgery for a living, do you think all cancers are morbid?
No, all are not morbid.
Are cancers survivable?
Yeah, cancer patients are definitely survivors. They can lead the normal life.
They can.
Yeah.
So it is not diagnose once and end all situation.
No, not at all. It's a myth basically. It all depends on what stage you are getting diagnosed and how you are getting treated and what is the biology of your disease.
Right. We also hear a lot of talk when people are considering cancer as a disease. But we often forget that there are many diseases available. There are many diseases present in the world that actually cause equal or more harm. For instance, TB still kills a lot of people. Dengue kills a lot of people. Malaria kills a lot of people. What is the mortality rate which actually brings in the fear when we speak about cancer?
See, apart from the mortality, what I've seen, patients reaching the doctor or medical fraternity at a late stage due to different reason. And secondly, people from Indian origin, they have got their own thought process. What they feel that this particular treatment, say cancer, has got multimodality treatment into consideration. And if you see the entire population that is being insured currently also is less than 10%. So they are much more fearful of the entire expenses or a financial expenditure that is going to happen in the entire circumstances.
What do you mean by multimodality?
Multimodality means in any cancer, there are 3 modalities or 3 treatments that can come into picture. One is surgery, where you remove the tumor. Second is giving chemotherapy, where you give injection in the form of IV drips. And third is radiation. So a combination of treatment comes in most of the cases. Only in cases which comes very, very early, unimodality treatment will come into picture.
Okay. You also spoke earlier about the data that we get in India. Do we have data centers in India which look after specific organ specific cancers or holistically cancers in men and women, which somehow supports you in order to make a judgment of what to do with the patient?
Yeah, we are definitely building up our registry and it has been very much updated nowadays. and it is definitely helping us because we are having our own research here. Till now, most of the guidelines were coming from Western here, which is not 100% applicable to our Indian scenario or Indian population. Now, with this registry, we are being able to formulate different sorts of drugs which are much more favorable in our population as compared to the Western ones. And similarly, the surgical outcomes, because our patients are much more in a catabolic phase, their weight is on a lower side. So it's a practical challenge for a surgeon, for a medical oncologist, as well as for radiation oncologist, how to overcome it. And with this data, it is helping us to fine tune the things, whether this particular patient should be taken up for surgery with this all the risk factor, whether they should be subjected for chemotherapy or immunotherapy, or whether they should be taken for radiation first, then project them for surgery.
So is this data well kept, better earlier or before, or earlier or now?
This is well kept now.
Well kept now.
Yeah.
What is the reason?
The reason being the digitalization of health and the entire healthcare industry. And now AI being coming into picture, it becomes very easy to capture the data from different places and put it in a single consolidated
cohesive
format.
way.
Yeah.
Okay. When we talk about data, we also talk about how it affects patients. But as a surgeon, how do you think it plays into your head? Because when you're in the operation theater, do you think about data or you think about this person's specific job that you have in your hand?
So whenever I'm performing any surgery, my entire focus is towards that particular individual patient, because we always do a sort of pre-operative planning and we discuss the entire plan with the team that this is how the way we are going to proceed for next 4 hours. So my entire team is synced on that particular protocol and fixed framework. Unless and until we encounter something which is not expected based on the scan report, our clinical judgment, then we might have to change our set. So we are very much focused on that particular.
So your homework is done before.
Yeah.
And you are well prepared to handle any complications on the table.
100%.
Okay. When you say that the cancer, if detected earlier, it is better cured. Is it better cured or is it better treated?
Both. See, if it is better treated, then it is better cured. If it is in the early stage, so overall, your overall disease-free survival, overall survival of the patient increases. Secondly, you might land up in taking either unimodality or bimodality treatment instead of having complete trimodality treatment.
Which means either chemo alone or with chemo with radiation, chemo with surgery, or
any mix and match based on the location of the tumor, the stage of the tumor.
Okay. So, as a head and neck surgeon in oncology, what is the most common misconception that you often face?
So, most commonly, what I've seen, oral cavity is such a thing where we daily brush our teeth and can see the oral hygiene, how it is.
Yes.
So, most of the time, people reaching us late is they believe that this is not cancer, something else. And they tend to hide this thing for a long duration. Long means say 1 to 3 months minimum. And that's where the progression happens.
Even a period of 1 to 3 months is long.
Yeah.
And it can change the stage from what to what?
First to fourth.
It can go from first to four in 3 months.
100%.
So what is the symptom that one should watch out for?
See, whenever you are in terms of oral cavity, you're daily brushing your teeth. The simple screening in the form of self-oral examination. While you're cleaning your teeth, give 5 minutes, examine the entire part of your oral cavity. During brushing, whether you're encountering any loose tooth, bleeding from gums, right? This should be taken as an important or a serious concern, right? If any lesion or any ulcer which is not getting healed for say more than 3 weeks, whatever treatment, multivitamin, ointment, gel, whatever you have done, should always be proven that it is cancer or not. Perform a biopsy or visit an oncologist, get the symptoms checked. For thyroid lesion or any neck lesion, previously what it was, if you have got some lymph node.
When you say lesion, you mean tumor?
Tumor.
Or a bulge?
Bulge. Or a swelling.
Or a swelling.
Lump. So whenever you see any lump in the neck, previously it was a dictum, if there is any lump on sides of the neck, it can be TB because it was most common and rampant in India. Now with different treatment modalities, first any lump, anywhere, always rule out cancer.
How to do that?
It's simple. Either you perform ultrasound of your neck or perform CT scan of the neck. See the features of that particular lesion or a lump. And if required, get small biopsy done. If that biopsy shows TB, then only start the TB treatment. If that biopsy shows something else, you have to get treated for that.
But doctor, can a CT scan or an ultrasound be conclusive enough?
So it's not 100% conclusive, but it will definitely guide us. Like I will give you an example. Whenever you are performing ultrasound for neck, so most important screening modality is thyroid. Right? In thyroids, there is something called as a classification of Bethesda. So where you classify the entire lesion in terms of Bethesda as well as TRADs. Like for breast, we have got BRADs. For thyroid, we have got TRADs.
Okay.
Whenever the TRADs is more than 3, 4, 5, with 5 different features like microcalcification, the size of the nodule, the vascularity of the nodule, the shape of the nodule. If it goes more towards 4 and 5, then there is strong possibility that this thyroid lesion is cancer.
It's
And
malignant.
it's malignant. FNAC, that is fine needle aspiration cytology, needs to be done for this patient.
And that comes faster, I suppose, than a biopsy.
Yeah, it takes hardly 2 days. If you perform it today, tomorrow you can get the reports.
All this while that you've been treating people, about 40,000 people that you've already operated on, can you find out one instance where you found it really challenging and how it changed you or made you learn something more?
So I remember one very important case, and being currently till now at this point of time, I'm the only surgeon from India who has done this.
Okay.
Oral cavity cancer surgery that we called routinely as either composite resection or a commando surgery,
Okay.
being performed in an individual with a bypass surgery on the same table.
Please explain. There's a lot of things.
So a person who was having heart disease and his ejection fraction was only 15 to 20%, all the 3 vessels were blocked.
Okay.
Angioplasty could not be done.
Okay.
The only option was to perform CABG, that is coronary artery bypass grafting,
So a bypass.
bypass surgery.
Okay.
At the same time, this fellow unfortunately got detected with a mouth cancer.
Oh.
Right. If your heart survives, then only you can take care of your mouth.
Right.
Right. So if you're taking care of your heart and if you're not operating here simultaneously, so once the patient is on a blood thinner agent, then I cannot touch this patient for next 3 to 6 months.
And then it will increase the stage.
Yeah. And chemotherapy cannot be given with a full throttle when the patient's heart is weak, because it has a tendency to cause cardiomyopathy and
Right.
reduce your ejection fraction, and patient may land up in failure. So it was very difficult situation, but I took a balanced call where the cardiac surgeon team performed first the cardiac surgery, that is the bypass surgery. In half an hour, the entire thing was reversed, because during the cardiac surgery, you give blood thinner agents. So your blood should keep on flowing, right? And we have to reverse that. The reheparinization has to be done. And after that, I've performed the commando surgery. That guy.
What do you mean by commando surgery?
Commando surgery is where you remove the jawbone, remove the lump from the neck, that is neck nodes, the fatty lumps in the neck from this level to downside here, and you perform a reconstructive procedure. Means a jaw is removed, then you take a graft from your leg bone, put it over here, right? Or you take a flap from the chest and put it here. This guy is surviving more than 8 years now, and he's healthy, hearty, no issues in terms of cardiac and no issues in terms of cancer.
So there were 2 surgeries being performed at once
Once
when the blood is already put on thinners,
blood thinners, yeah.
and you have to work, counterproductive, because the blood thinner is counterproductive to you,
Yeah,
and for them it is needed.
yes.
So it was very challenging.
Very challenging.
How long did this surgery last?
The bypass surgery lasted for 4 hours and my surgery lasted for 6 hours.
All the best to that patient. I hope he survives longer and longer. In terms of lifestyle, because nowadays we speak a lot about how lifestyle plays a role. To the people who are listening to you, people who have cancer, people who are watching out and looking after themselves and their families, what is the message, what is the guideline that they should follow from you as a doctor?
See, what is most important, every individual nowadays should incorporate in them a healthy lifestyle. Healthy means different forms of exercise should be done at least 30 to 45 minutes a day. And you should try to do it 4 to 5 days a week.
But doctor, today from a shaman to a minister, everybody is telling you another way of living healthily. Give me a blueprint.
See, basically, I will tell you a small EA. If you do 2 days a week cardiac activity, if you do 2 days cycling or swimming, and 2 days gym or some sort of, for 30 to 45 minutes, everyone can spare. It all depends how we put our schedule across. Secondly, what is most important? You should stop junk foods in between the meals. What is most important?
In between the meals.
In between the meals. And during the meals, if you have to consume, it should be either once a week or something like that. Because in junk food, specifically Chinese food, lot of substances that gets added, like Ajinomoto, these are all precancerous or carcinogens. Right? These should be absolutely avoided. And if you want, you can have in very less quantity and less frequency. Coming to lifestyle, what lot of individuals have a wrong thought process nowadays, I've seen. Sir, we don't smoke, but we do vape.
Which is much more dangerous.
Which is much more dangerous. And their frequency is much more higher because they don't have to move out.
Yeah.
They're very much comfortable sitting on a chair and vaping out, which is not disturbing the other EA. They might be getting a passive smoking.
Yes.
Second-hand smoke that we call. And the flavors that are being made in this particular vaping agents
are pure chemical.
They are pure chemical. There are 213 different carcinogens have been identified, which are being used in different combinations to create different flavors. So indirectly, they are loading themselves with a carcinogen, which is a precancerous EA, which changes again, alters your cell cycle. And if that stimulus comes on repeatedly by your repeated vaping, then you're bound to have cancer at some point of time.
You see a lot of patients with vaping history in India as well?
Yeah.
Vaping. Not just regular tobacco, BD, cigarette, gutka.
Vaping. New generation. I've diagnosed cases and treated cases of oral cancer as young as 9-year-old.
What are you saying? And in a teenager, because of vaping, what is the youngest that you've operated on?
15 years.
Because of vaping?
Yeah.
Their parents must be devastated.
100%.
Did that person learn a lesson?
He is very much that throughout the life he is not going to. But whatever damage that has been done to his body has been done.
In India, vaping is not legal.
See, a lot of things are legal and a lot of things are illegal. It's a grey area. And if somebody wants to do something, they can definitely do it.
You must be feeling very unfortunate when you see a patient like that.
We feel very much unhappy, basically. See, I'm treating those cases, that is a different part of the story. But when I see in terms of humanity, it feels very bad.
Yes.
Because what the thought process might be going into the minds of their parents, those who have spent money to train these guys, and these guys are using that amount to get themselves addicted, and then their parents are spending money to get these guys treated. And even they've not reached the age of their marriage, and they're already a cancer patient.
Does, like, if a 19-year-old teenager is diagnosed with a mouth cancer because of vaping, does it affect their overall longevity?
It all depends at what stage they have come to me. If they have come to me at an early stage, what we define as stage 1 and stage 2, definitely they have got good longevity. If they are coming at late stage, then the longevity is definitely on a lower side.
Which stages fall into the category of curable in head and neck cancer?
See, in head and neck cancer, you can operate or perform surgery or give curative treatment from stage 1 to stage 4B.
Okay.
Right. But what is most important whenever you are treating the late stage diseases, the biology of the disease, how well the surgery has been done, and how good the patient has adhered to the entire treatment protocol. Suppose I am performing the surgery, then the patient has been advised to take chemo and radiation after the surgery. The patient has to complete the entire sequelae of the test. They should not feel happy that surgery is done, now we are done. No, they have to complete the treatment, and at the same time, once the treatment is done, they have to keep themselves on regular surveillance. Regular surveillance is very important in any cancer patient.
What does that involve?
That involves routine screening. For initial 2 years, patient has to consult doctor every 3 months. And in those 3 months, repeatedly, we do different modalities of investigation. Like for first 3 months after the surgery, we get the basic ultrasound neck done, we get chest x-ray done, and few blood investigations done. Right. After that, The next 3 months, that is 6 months from the date of surgery, we advise them to undergo again CT scan of that operated site. Once they complete 1 year, once a year, PET CT has to be done. That's how we keep the patient under a close observation to see whether the disease is relapsing at a local site, at a local regional site, or any distant spread.
Wow. You have been practicing for how long?
13 years.
13 years now. In these 13 years, do you see a lot of promising research coming up in the country?
Yeah.
Or is it even comparable to what is happening in the West?
We are at par with them right now.
We are at par with the West?
Yeah.
How would you say so?
So recently we have got one very important paper like Keynote.
Okay.
Right. In terms of head and neck cancer. Previously in locally advanced, means stage 3 and stage 4, mostly stage 4, were given chemotherapy. Now with chemotherapy, immunotherapy has been added to that. And it has shown that the relapse rate, which was almost 40%, has got dropped down to 13%. It's a significant drop.
With chemotherapy?
Chemo with immunotherapy added.
With immunotherapy.
Which was not being done previously. Only immunotherapy was being given if either the patient is palliative, say where we cannot treat or cure it, or where it comes as an adjuvant after surgery. Now it has come up in a new adjuvant setting. Means before surgery, to downstage the tumor and to make the entire disease favorable for surgery, and the overall outcome also improves.
Doctor, something that I personally have always, found myself at loggerhead with, and I could not fathom the conundrum, the paradox of the situation after my recent experience. We can land an unmanned spacecraft on the surface of Mars, going through the challenges presented by space, time, gravity, and several other thousands of complications. Yet, we cannot be sure if we remove a tumor surgically, that this tumor would not come back, the cancer would not come back. Why do you think that is? Why can't we still not be sure that once we remove the cancer surgically, it will not come back?
See, what it happens, every disease has got a different biology, right? And like I will give you example of, say, breast cancer. So whenever an individual with a breast cancer is being treated, there is something called as a tumor circulation, circulating tumor cells, right? You remove the disease from that particular affected area, but there might be circulating tumor cells present in your body, right? And that circulating tumor cells are the most important culprit to throw seedlings in different areas of the body. Till the time you take care of circulating tumor cells, treating the disease from one specific site is not going to treat the patient as a wholesome way. Why I have taken breast as an example? Because breast is not a disease of one specific organ.
Okay.
It is a systemic disease. And circulatory tumor cells play a very important role. And just to give you a perspective in that year, whenever a patient undergoes surgery or say completed the entire treatment, nowadays with research, we don't have to perform PET CT scan every now and then. If you take simple 5 ml blood of that particular individual who has got treated and see the CTC level, circulating tumor cell level, that will be your first parameter. If it starts rising, that this patient is bound to relapse. Right. And why we are not being able to 100% here? Because the entire biology or say the genetic mutation is changing so rapidly. It's not a fixed mutation. You remember the challenges that we have faced during preparation of vaccine for the COVID thing? Because that virus was mutating very rapidly. They have developed 1 year, the subsequent strain that has hit had got some different mutations. So if the mutations are much more aggressive than your presumptive year, it's difficult to treat or to say that we have fully controlled. You can control the things, whatever is possible and within your purview. Say if I am a surgeon, I'm operating any tumor of breast cancer or head and neck cancer, I will take my entire decision and judgment based on the scan report, right? And I will remove the entire thing with a good and a decent margin, get it checked in a lab. But what about the systemic component if it has already been started microseedling?
But doctor, again, I come back to my question. We have developed technologies where we beat our own atmosphere, our own gravity. We go into space, into the unknown, where no man has ever physically been in a capacity where they can do the first-hand research, hand to hand. We send our probes and crafts to different heavenly planetary objects, which I'm sure requires a lot of science and a lot of complications, and it is, I'm sure, very, very difficult. When you say that it is difficult to treat this micro cell, that circulating tumor that's spread in the body, is it more difficult or challenging than rocket science?
If you see, it's a very good question. NASA has not landed the entire thing in a day's time.
Yes.
They have done research more than 100 years into that. Similarly, the cancer has been very much active since last 2 or 3 decades. And research is most dynamically progressing in this field. If you see what is the current most dynamic and daily changing era in terms of medical fraternity, is the cancer, which is reinventing the wheel every day with different sorts of research coming into picture. You might have got a news that Russia has developed some sort of vaccine. So I'm quite sure with our scientists from both Western as well as our country, we should see a good progress, say in next 1 decade's time, that where cancer is again treatable, curable, where you can have a normal lifespan. Because similar sort of frightening or threat was there when there was an incidence of tuberculosis in the past. When people used to get typhoids, they were fully threatened. They will not be able to live or survive. Now nobody cares for that. And I feel it's a matter of time that our science and scientists reaches that particular level where we feel every cancer is treatable. And in fact, our screening modality becomes so much tightened that we are being capable of detecting the disease at a very premature state.
I understand, but when we face challenges in our lives and when we see our loved ones going through some difficult times, it is very hard to believe that we don't have the power to do anything. And we only trust the people who are experts in science, just like yourself. But you also have limitations. You can only do so much. If you are a surgeon, you cannot be spending your entire life doing research. Why I ask you is because I want to understand from you, because you are at the forefront. If it was a situation of war, you are like a soldier on the front line. So, is there enough research? Is there enough will backing you up with cutting edge sciences in terms of new vaccines that we always keep on hearing? There is always a new news, as you said, some vaccine is coming up in Russia, something here, something there. But why don't we see it in our lives?
We are seeing it. Definitely a lot of progression has happened in terms of breast cancer and lung cancer. Previously what it was, the patients, those who were in say stage 4 for lung cancer, those who are having fluid accumulated in their chest, it was the last day of their life. But now it's not, because we are doing the different markers for them, whether they are positive for that particular marker, and they have to take simple tablet in the form of a medicine for their BP or diabetes. And with this medicine, we have seen the survival rate of even stage 4 lung cancer to more than 5 years, which is a significant time, which was not in the past. So we are definitely seeing a lot of progress, and I'm very confident with the science and our scientists, the way they are progressing, we should have good results in next 3 to 5 years.
I want to play the devil's advocate here.
Yeah.
Do you think the science is willing enough to cure the disease, or they just want to treat the disease?
The science wants to cure the disease. They don't want to treat the disease. See, there are two things. Whether you want to treat the disease with a curative intent or a palliative intent, that all depends on the stage of the entire. So anyone going to any doctor, any medical fraternity, as a doctor, I would always be happy to see my patient on a curative arm. It makes me very much disheartened when they fall on the other side of the road, because I know what might be the lifespan. So our entire treatment currently of a medical fraternity is focused on a curative intent, and our researchers are also focusing on a curative intent line, and they are trying to reduce the cost of drugs in different way. If you've seen, government has done enough packing in the recent formulation of taxation. They have reduced the taxation rates and
On
GST
chemo
rates
and,
on chemo, which has significantly dropped.
Yeah.
We are getting generic medicines. We are getting medicines from China.
Hmm.
And the price, say, which was previously 3 lakhs for one single dose, has now been dropped down to 15 to 20,000.
Do we have enough? Let me rephrase the question. As far as my understanding goes, I don't see a lot of trials happening in India.
You're absolutely wrong.
How? Because
See,
when I speak about my experience and the drugs that I wanted in India, there are many drugs that are orally available for which there have been some trials, but largely what I am told is that India is not very, welcoming to do trials because of our red tape. What do you think?
India is definitely progressing significantly in terms of clinical trials and research.
Okay.
If you compare what was the number of trials that were happening in the past year as compared to last 5 years, specifically in a field like cancer, it has increased more than 4 times.
What are the current trials that you are aware of happening in India?
Almost more than 200 trials are there for head and neck cancer patients. In terms of different sorts of treatment modality, how they can increase their longevity, how they can prevent the relapse of the disease, and how they can downstage the tumor before surgery so as to give them a good outcome. So it's a significant number. 200 trials focused on performing for head and neck cancer.
How many people do they take in one trial?
It all depends what is the sort of trial. See, any trial, and these are the trials, these are big trials basically.
Sorry, for our viewers' understanding, could you please explain how a clinical trial actually functions?
So basically, whenever any drug is being formulated, whether this drug has got efficacy or not, it is basically a randomized control trial. The number of patient population and a control population is already being pre-decided. So they decide more than 100 individuals in both the arms, and it is sort of double blindfolded study where nobody is aware which one is going to fall on which side because they want to judge the report in an honest way, whether the patient is actually responding to the treatment or whether placebo is also responding to that. Right.
So the 50% of the people will be given a placebo, which means a fake pill.
And nobody is aware. Only the investigator, they know the first number is this, the second number is that, third number, fourth number. And based on the entire interpretation, then it is being seen at the end of the study that whether the entire analytical result that has been achieved, what is statistically significant in that. Whether it is statistically significant in terms of reducing the relapse rate, increasing the disease-free survival, increasing the overall survival of the individual, then that particular drug is being taken into consideration for a broad scale use.
Okay. What about vaccines? Is India coming up with any cancer vaccines?
India is definitely building the vaccine in collaboration with Russia.
Okay.
Like during the COVID times also.
Which cancers?
They're trying to make the vaccines for breast cancer, colorectal cancer.
And?
These are the two most. Already we have got 2 vaccines like HPV vaccine and hepatitis for liver cancer.
Okay. Is it enough?
Nothing is enough till the time you target all the organs which are capable of producing cancer, and you have a vaccine specific for that cancer. That will be the last day of year where we have got enough vaccination. Like we have targeted all the diseases and we have got all the vaccines in our Indian Association of Pediatric Vaccination schedule. So we need to target from head to toe all the organs which are capable of producing cancer, and we have a vaccine against that.
A vaccine essentially works to enable your immunity system to fight with the disease, correct?
It prevents the occurrence of the disease. It prevents the mutation that can lead to occur that disease.
Okay. But our body again it has a large microenvironment. Do we have in India enough capabilities or departments or specializations going after different sets of organs?
We definitely have got.
Is there a government will behind it?
Yes, Even if you see in an institute like Tata Memorial Hospital, which is very much there located in Mumbai itself. So now their team is entirely working on an organ specific way only. So every team is different. The team for head and neck cancer different, breast cancer different, thoracic cancer different, GI cancer different. Again, GI divided into upper GI, lower GI. Bone and soft tissue different.
When a person is diagnosed, if affordability is not an issue for them, they would firstly Google which is the best cancer hospital in the world, and they would want to go to that hospital. And more often than none, I would say people find these hospitals in the United States. If we are at par in our medical treatment, why do we have to go to the States or any other country?
Even in United States, I will give you one example. Since I'm a head and neck surgeon, so the chief of MSKCC in head and neck department is Dr. Jatin Shah, and he is again an Indian trained guy, and who has been living in States for more than 4 decades, and he has been trained from the same place where I have got my super specialization degree from GCR Ahmedabad. So Indian surgeons are the best surgeons all across the globe because they have treated the patients in numbers.
Yeah, exposure.
Exposure is significant and to a different level because they have catered to the masses.
When you remove a tumor, or you do any surgery, what makes sure that it is not going to come back?
See, it all depends on whenever I remove a tumor or any cancer surgeon removes a tumor, what he sees while removing it, that his surgery should be adequate with a good margin. Whenever he is...
Please explain margin for our audiences.
So any tumor, whenever we remove, we don't remove the tumor hugging the tumor. We take more than 1 centimeter margin beyond the tumor spread. And that too in a 360-degree fashion. Right. We send the entire specimen for frozen section. What is frozen section? It is a form of histopathological examination where we get the report within 30 minutes that all margins of the tumor are clear. There is no microscopic spread along the margin and margins are adequate. That means our entire surgery for that part is absolutely perfect, which has been decided and seen by pathologist on the same day at same point of moment. If any revision is required, because I'm going to perform a surgery which is being seen by me with the help of a scan which was done previously and my naked eyes, right? But pathology sees that entire disease in a microscope. Sometimes there might be some mucosal spread of the disease which was not there in the scan, not seen with the naked eye. So,
and you could not have done that before the surgery.
Yeah. And if any margin is close, we have a time that on table we can revise that particular margin so that the disease does not relapse. And when you are addressing a neck of that particular individual, you need to take care that all the lymph nodes have been knocked off and everything is entire area is free of all lymphatic tissues.
Are all cancers genetic?
No.
Please explain.
So in head and neck cancer, if you say, the genetic preponderance is only hardly 4 to 5%.
Okay.
In breast cancer, it is slightly higher.
Yes.
In colorectal cancer, again, it is slightly higher. So it varies which cancer individual is having.
So if someone has a cancer gene, does that mean their fate is sealed? They would eventually get a cancer today, tomorrow, day after, 10 days later?
No. See, pertaining to this, India has been evolving very much. And nowadays, we are doing something called as a genetic analysis. And this can be done by a very simple test like a swab from your saliva or a 2 to 3 ml of blood sample, where you can see which are the cancer preponderance that you can have in your body apart from your genetic. Right? Like I have done the entire test for myself and I'm very much frank that I need to be very much cautious when I'm exposed to sun because my skin might have tendency to develop skin cancer.
Oh.
The second important thing is urinary bladder cancer. So I have to keep myself hydrated very well. So now the genetic test, and I should keep the entire things in very much, say on a radar, that if I've got some urinary symptoms, I should look for hematuria, any burning micturition, should get my ultrasound done repeatedly, say once in 6 months. So now different test has come up which can give at least a direction which you should be aware and keep yourself checked on that particular parameter, which is very easy because I'm very much focused now. Say out of 100 spectrum, I'm narrowed down to 2. and I need to just take precaution.
So genes are okay, but lifestyle is essential.
See what it happens if you've got some sort of genetic changes. Like I will give you example of like I have given it for me. If again I have got a preponderance for lung cancer in my genetic study, and if I'm a heavy smoker, so what is happening? So I'm adding fuel to the fire. My body has got inherited tendency of developing lung cancer, and I'm again a chronic smoker. So I'm bound to have lung cancer is bound to happen to me.
What do you really mean for our audiences? What do you really mean predisposition of genes when it is related to cancer? Predisposition का मतलब क्या है?
So everybody's body has got different genetic makeup. It all depends on the genetic lineage of that particular individual.
Okay.
Right. Having a preponderance or a predisposition to specific cancer does not mean that you are going to have that cancer. You need to be alert to that cancer. You need to keep yourself screened in that particular category. And if any added stimulus is being given to your body, which increases the risk of that particular cancer, can be dangerous. So you should always avoid that. Like my body is prone to develop skin cancer, and if I do some activities which keeps me away in the sunlight without taking adequate precaution of applying say sunscreen or then at some point of time I might develop skin cancer.
So how much of a genetic predisposition is responsible for anyone's cancer in percentage?
Overall, if you see, it's 10 to 30%.
10 to 30%.
Overall, if you see, right, 10 to 30%.
Okay.
And if you see specific organ wise, it has got different here. Like head and neck, I've told you less, breast slightly higher, colorectal again falls on a higher category.
Doctor, we are Indians. We've seen in our culture there are yogis who live for a very long time with bare minimum, facilities and materialistic wealth around them, or even care for that matter. They are, I'm very sure, also disposed as us genetically. Why do we not see them suffering with things like cancer?
2-3 things are very important in terms of yogis. First, their environment is absolutely pure. We all live in an impure environment where we are predisposed to different sorts of genetic chemicals which we are inhaling, even though we might not be a smoker. Right. Secondly, if you see their food habitat, it is the natural things that they consume. And we consume all the foodstuffs which has got test due to different chemicals that are being used for the preparation of that. Third, our lifestyle has got some or the other sorts of addiction. And we always keep ourselves in a stress. They don't have any stress in their life only. They roam without clothes, they hardly care who is seeing what and who is telling what. Right.
So is stress a very big reason?
Stress is one of the reasons. See what it happens. Nowadays, people call themselves as we are in a very much stressful year. They start different sorts of addiction. Say whether having alcohol, cigarette, vaping, all that. It keeps on continuing. Stress is added to there. And if you've got genetic predisposition, all three factors coming into simultaneously, you will have cancer at some point of time.
But doctor, you are such a busy man. You handle so much. How many surgeries did you do today before coming here?
3 surgeries.
Okay, so he's done 3 surgeries before coming here. My question to you is, how can you as somebody who's at the front line, who's handling things, making, disease go, treating people, handling so much, how can you not be stressed?
See, it all depends. It varies from human being to human being. So much more the time you spend in this particular field, you develop to keep yourself in that calm and cool zone, because your outcome is going to improve the much cooler you are. Even in operation theatre, if you're yelling at someone, the entire outcome of the team deteriorates. Right. The similar thing will happen if you're conducting the OPD in a bad manner. Right. And the similar thing happens if you go from your workplace to your home. If you carry the same stuff at your home. So what is my important phenomena is that I keep myself switch off when I reach my home, unless and until it's very emergency and I get a call. So you have to just balance your personal and professional life. And to keep yourself recharged, it is very important and mandatory that you need to get some sort of break every 4 to 6 months, say for a week's time or whatever it, with your family.
I could not have fixed my car's tire and come here and be like this. You said you did 3 surgeries and you're like this. What do you do to be such a calm person after doing surgeries and coming for a podcast like this? What makes you so calm? You're probably much calmer than anybody on the set, by the way. How do you do this?
See, basically what I feel, this has also come over a period of time. I feel that overreacting or doing the things in a, say, hyper manner always has got a bad outcome. If you take the things as it comes, if you take the things in a slow and a calm manner, the outcomes are always going to be good, right? And you are capable of putting your thought process in a much better way, because that gives you time to think, align, realign, and perform it. And you're focused at the job that you're doing. If somebody, I'm so much specific about the timing. She has told me first 3:30, so I have fully organized my entire theatre as per 3:30. So I knew I should reach here by 3:30, though I was late by 3-4 minutes.